I always forget to hit record. Oh, we are live, rocking and rolling. What's happening, team? A client reached out and was talking about lower back pain. So let's get into it. Let's get into the lower back pain. You guys aren't going to see my presentation here. You guys are going to be the birdie on my front shoulder. If you guys do want to come in day one den on the school platform, let's see here the architecture of back pain. Just actually, you know what? Let's do the little blog post information first, real quick. All right. Oops. All right. So your back's hidden language. Hidden language. Six surprising reasons your spine still aches and how to fix it. Beyond the back cliche. It's an all too familiar frustration. You have invested in the high-end ergonomic chair. You are meticulous about your lifting technique, and you have a dedicated collection of heating pads. Yet you still wake up feeling stiff and depleted. For many, chronic pain feels like an unsolved riddle. However, as a rehabilitative specialist, movement specialist, certified personal trainer, martial arts instructor, I often see what we fail to find relief because we view the back through a narrow mechanical lens. To truly move without fear, we must stop seeing the spine as a rigid stack of bones and begin seeing it as a biological system. Your back is a complex network of stabilizing muscles surrounding your spinal tunnel, a bony corridor designed to protect the delicate travelers that are your nerves. When this system's needs aren't met, it speaks to us through a hidden language of pain, fatigue, and chemistry. The shadow muscle, while your multifidus, is the key to stability. While most people focus on their six pack, guilty. While most people focus on their six pack abdominals, there is a deep shadow muscle that acts as the ultimate stabilizer, the multifidi. These small muscles run along the side of the vertebrae, the bony blocks of your spine, and are responsible for maintaining precision alignment. Because we use our legs for walking, these deep stabilizers are usually not actively engaged during everyday activity, leading them to weaken with age. Research suggests this is the weak link for many. In fact, nearly 80% of chronic low back pain sufferers exhibit direct weakness in the multifidi. If this muscle if this muscle weakens over time, what it will do is force the other muscles to compensate, leading to spinal instability, muscle strain, and eventual pain. The fix, the answer. Before performing any exercise, you must re engage this muscle using a technique called stomach bracing. Imagine someone is about to poke you in the stomach. Mimic that tensing sensation to flatten the curve of your lower back once braced. And of course, try a progression of the Superman, Superwoman. It's funny, like whenever I'm working with a client in person and we'll be just talking. I might be holding a target paddle, or even a iPad or something, and we'll be talking, and I would fake to hit my client in the stomach. Obviously, a light tap, but it's just protecting that core. So you want to think you gotta have that core braced, okay? Or when I was in the gym, and I'll be walking around with my bow staff, because I use that for posture and technique and basically a dowel rope. As I walk by in class, and I would get everyone to do a front plank, and you can curve, you can focus on the shoulders, you can kind of cheat your way in the system. So I'd always walk around with my bow staff and swat right in the tummy. Anyways, yes. So a progression from that core brace is the Superman Super One. So step one, lying on your stomach. So remember, supinated is up, pronated is down. So pronated, body posture, pronated, lying on your stomach. Slowly lift only your head, shoulders, and chest. So this is number one. Step one, lift your shoulders, head, and chest off the ground. Step two, once comfortable, add the full version by lifting your heels and your glutes, activate your glutes toward the ceiling, keeping your legs straight to trigger deep activation. So that's the full Superman, Superwoman. To make it easier, just have the upper body only, still activate the glutes, feel that low back. And of course, to progress to the full version of the Superman exercise. Decoding the dialect. What your pain descriptors are actually saying. Your body doesn't just hurt, it speaks in specific dialects that help us locate the source of distress. So we have muscle pain, typically described as achy, sore, or tender. It often involves knots or spasms in the layers of the cake, the various muscle groups surrounding the spine. This pain usually responds well to heat and massage. Bone pain. This feels stiff, sharp, or deep. It is often linked to arthritis, wear and tear, and it makes it difficult to get out of a chair after sitting for longer periods. And nerve pain. This is the most distinct signal from the body's power cord. It feels like burning, electrical, or shooting, often radiating down the legs, sciatica. Nerves send these exaggerated signals when the spinal tunnel narrows or a squishy brake pad, your disc, presses against them. Okay, so now we have the thirsty spine. Why your lower back needs a glass of water. Think of your spine not as a rigid pillar, but as a garden that requires constant irrigation. Between your vertebrae are intervertebral discs that function as shock absorbers. These discs contain a jelly-like substance that is approximately 90% water. So when you are dehydrated, these discs lose height and the squishy integrity needed to protect your bones. An expert at Ace Sports Clinic note, these discs partly comprise a jelly-like substance, about 90% water. This is one of the reasons you should make sure your body is always hydrated to help keep the gel active as required. The fix. To maintain this biological cushioning, aim for 8 to 10 glasses of water daily. Hydration is a requirement for spinal flexibility. Without it, movement becomes friction-filled process. It becomes a friction-filled process. The fatigue paradox. Why your pain makes you mentally exhausted, despite dealing with other individuals who may be contributing to that factor as well, that is outside of your control. Anyways, Chronic back pain is a massive energy drain, often leading to a vicious cycle of exhaustion. This happens partly through postural compensation, where your muscles work overtime to protect an injured area, leaving you physically spent. However, there is also a phenomenon known as centralized pain. This occurs when the nervous system becomes hypersensitized and the brain begins over-reporting pain signals even without a visible injury on an MRI. This constant state of high alert leads to significant mental fog and systemic fatigue, as the brain is perpetually busy processing exaggerated danger signals from the spine. Now we have the kitchen pharmacy, fighting spinal fire with food. Back pain is often fueled by inflammation, and your diet can either dampen that fire or feed it. Pro-inflammatory foods like white flour, sugars, and red meat trigger biomechanical processes that increase joint swelling. Conversely, an anti-inflammatory diet acts like a natural pharmacy for your spine. The top anti-inflammatory allies. So we have turmeric, and I'm going to say this, I'm going to butcher this name, C-U-R, curcumin. Turmeric, I do know of, a powerhouse for reducing joint swelling. Pro tip, take it with black pepper and a teaspoon of coconut oil, or GHEE, to significantly increase its absorption. So turmeric, this is a top anti-inflammatory allies. And of course we have ginger. Consume it fresh in warm water to help reduce pain markers. Omega-3 fish. Salmon and tuna are essential for reducing inflammatory markers. Forgot to turn off my do not disturb. Raw vegetables, in addition to antioxidants that support tissue repair. So raw vegetables, high in antioxidants to support tissue repair, is highlighted by Ace Sports Clinic. Curcumin helps fight any form of inflammation, thereby reducing joint pain and swelling. This is a big one here. All right. The truth about heavy-duty fixes, opioids, and surgery. I'm going to turn off my do not disturb. I'm in session. Of course, I messed it up. Hope not. All right. The truth about heavy-duty fixes, opioids, and surgery. In our search for a quick fix, it is easy to be swayed by the promise of opioids or complex surgeries. However, a reality check is necessary. Opioids are heavy-duty tools that function by shutting down the brain's pathway. They do not address the source of the pain. When the medication wears off, the pain often returns unchanged, or worse, as the body becomes more sensitive to pain signals. Surgery is rarely the first answer and should be reserved for emergency situations. Similarly, experimental treatments like stem cell or PRP therapy for the spine currently lack evidence of functional benefit and can be an unnecessary risk. Safety first. You should seek immediate medical attention if back pain is accompanied by red flags such as fever, unexplained weight loss, or a sudden loss of bladder or bowel control. In conclusion, reclaiming your movement. Managing back pain is a team sport that requires a coordinated effort between your daily habits, ergonomic awareness, and gentle movement. By understanding the hidden language of your spine, from the hydration of your brake pads to the bracing of your multifidi, you can move from reactive treatment to proactive health. If you treated your spine with the same daily attention you give your teeth or your skin or your hair, how differently would you move 10 years from now? Your back is the foundation of your movement. It deserves your focus and care. There's a little more there. Beyond the back cliche, the shadow muscle, the fix. All right. So that was a quick little blog post. I'll post this on once I finish here. I'll post this onto the platform for you guys and gals to take a look at, and we'll go through. Share my screen. It's pretty cool, right? So yeah, so you're just taking care of. It is. Just like how I tell clients all the time, just like, well, when you have your car and you take it for a tune-up, you want to make sure that you are addressing all of the exercises that's needed to keep your body, your temple, your mental state healthy and strong, right? So doing the fire hydrants, doing your planks, doing the stretches, doing having being that having your body hydrated, right? Drinking non-sugary drinks, making sure that you are eating the rainbow, right? All of this factors into your overall well-being and, of course, your back health. And if I'm sitting down all day, I better make sure that I have a program in place that is daily. If I'm sitting down daily, I'm going to have to make sure that I'm stretching daily, that I'm doing my hamstrings, figure four, child pose, side planks, Superman, Superwoman, like glute bridges, single leg glute bridges, my hip hitch, where I raise up one hip, making sure that I have ankle stability, that I am doing my squats, lunges, sumos, single leg balance, doing my what else we have there. So I know I just cracked up a whole bunch, but all of those exercises that can be done within 10 minutes, that we can do that in 20 seconds per exercise, and your body will love it. Your body you'll have the energy to show kindness to others, as opposed to being stressed out and angry and agitated. I'm stressed out and angry and agitated because I need to hit. That is my healthy replacement for a DOC. If you know what DOC means, you know what I mean. And yeah, I have to hit, so I have to, I got too aggressive on the heavy bag, and I hit wrong, improper, and I cut open my knuckle. So now I gotta wait and let that heal. Because normally I don't. Normally I don't let it heal, and I just put bandages all over it and I cover it up in hand wraps, and I'm in a far worse off position. And of course, too, in regards to that as well, too, like just to touch base on. I don't have to mention that. It's okay. But anyways, yeah. So all those exercises that can be done daily, and you're just having that awareness of how your posture is, your core, what you are eating, will factor into your success for the long run. All right, share my screen. Which one do I want to share? Comprehensive guide. I want to share is the spinal blueprint. Spinal blueprint it is. All right. The architecture of back pain. So this is a quick 15-page slide for everyone to take a look at after. What's going on here? Why is it all, I better move. Why didn't it fit? That's okay. So we have, right here. So just like we're talking about in that little blog post or that little intro that I just talked about, the tunnel system, deconstructing the spinal segment. So you have the blocks, the windows, the power cord, the shock absorbers. So that tunnel system, L4, L5. Actually, I'm just going to move. No, it's good. And of course, just the muscle groups and the overlooked core. So the support cables, superficial layers, extensors, standing, lifting, flexors, bending, forward, obliques, rotation, and posture. And the support cables, the superficial layers, extensors, standing and lifting low back, obliques again, flexors bending forward. Again, clinical key clinical insight: 80%, 80 of individuals with chronic low back pain show direct weakness in the multifidi. When this deep stabilizer weakens, superficial muscles must compensate, leading to chronic spasm and instability. Diagnostic matrix, decoding the language of pain. We kind of touched base on this already. Muscle pain is achy, sore, tight, throbbing, highly sensitive to movement, relieved by heat, rest, and massage. Bone and joint pain, stiff, sharp, decreased range of motion, noticeably worse in the morning for bone and joint, triggered by prolonged sitting. And then nerve pain, sciatica, burning, electrical shooting numbness, distinctly radiates past the knee, tingling sensation in extremities. Jazz hands. Centralized pain, severe, debilitating pain out of proportion to imagine. Central nervous system, hypersensitivity, and we have structural failures and biomechanical triggers. Herniated discs, spinal stenosis, osteoporosis and fractures, weak abdominal flexors and tight hip flexors. So sway back, you guys can't see this here, but so sway back, so weak abdominal flexors combined with tight hip flexors unevenly tilt the pelvis, crushing the lower facet joints. So that's the anterior, posterior, anterior tilt. So that anterior tilt from sitting down all day, having a weak core, and tight hip flexors from sitting down all day, shifts that pelvis forward. Right? So that's sway back, lordosis. The vicious cycle of chronic back pain. So pain and sleep distribution. Discomfort prevents finding a restful sleeping position, destroying restorative sleep cycles. I've been sleeping on my shoulder, my right shoulder's been jacked up, so I got to really make sure I use bands. I got to tighten up a little bit. I know it's probably I have to, could be a pillow issue. All right, so pain and sleep disruption. Then we have muscle imbalance and spasm. Unused core muscles atrophy while compensating secondary muscles going into tight, painful spasms. And then we have chronic fatigue and stress. See how all of this plays into weak low back, weak muscles that atrophy, and dealing with stress in your sleep and that chronic pain. See how all of this takes down your battery, so to speak, right? Your phone battery here. So chronic fatigue and stress, deprived of deep sleep, the body fails to repair itself, to repair tissues. So the nervous system becomes hypersensitive. Inactivity and compensation. Exhaustion leads to sedentary behavior, which reduces blood flow and starves the spinal discs of nutrients. So red flags: when to seek immediate care. Incontinence, new onset of the bowel or bladder control loss, indicates severe spinal cord compression. Progressive leg deficits, numbness, tingling, or weakness that aggressively spreads below the knee. Systemic systems, unexplained fever, chills, or sudden weight loss, infection, or tumor risk. Direct trauma, severe pain following a fall, car accident, or deep impact. The diagnostic toolkit, mapping the blueprint, X-ray, MRI, CT scan, EMG, and of course then we have the biomechanical foundation, raw materials, pro-inflammatory triggers, avoid, so we want to avoid trans fat, avoid processed sugars, white flour, and high red meat intake trigger systemic inflammation via complex hormone processes. Anti-inflammatory diet, consume omega-3s, salmon, tuna, turmeric, ginger. As we kind of talked about this, bone density. So calcium intake is vital. 800 to 1,000 milligrams for men, 1,200 to 1,500 milligrams for women to delay osteoporosis and prevent vertebral fractures. And lifestyle biomechanics, navigating the physical world, lift smart, let the legs do the work, keep heavy loads close to the chest, never bend and twist simultaneously in real world activities. However, for workouts to develop this exercise or to develop the muscles for rotation power in your sport, in kickboxing, in MMA, and we are doing this move purposefully. And of course, sit smart, lumbar support, adjustable support, level hips and knees. Maintain neutral pelvic alignment. Use lumbar support. Change position every 30 minutes. Change position every 30 minutes. Stretch, stand up, forward fold, lateral bend, lateral flexion. I give up position, hands up, crossbody stretch. Hit that extensors on the neck, flexors on the neck. Crap. I'm not too far on that one. And sleep smart. Let me go on here. I lost my page. Everyone. It's not fitting to you. Let's go. Oh, you son of a gun. You son of a gun, you. You son of a gun. Image the arrow. Nope. Sorry, team. Sleep smart. Invest in a supportive mattress. Utilize melatonin. And you want to utilize melatonin and reduce screen time to enforce sleep hygiene and break the fatigue cycle. And of course, quit smoking. Smoking aggressively decreases spinal blood flow and causes chronic coughing, a leading trigger for sudden disc herniations. And of course, targeted rehabilitation. So as mentioned, we have the Superman, Superwoman, pronated. And of course, we have the bear plank or bulldog position, quadruped position with a hydrant. So from all fours, brace the core to flatten the lower back, then lift one knee outward, builds rotational core stability. So doing the fire hydrant from the bulldog position. Then we have a modified bird dog from sorry, my mouse here keeps modified bird dog. So again, from the quadruped position, all fours, bulldog position, slide the opposite arm and leg out parallel to the floor, strengthens cross-body coordination and stabilizes the pelvis. Cross-body coordination, huge factor for your low back, rotational sports, and also too for your gait cycle for running, to improve, to strengthen. Muscle relaxants, we have to talk about that one. The injection ladder, we have to talk about that one. Decompression and stabilization before and after. All right, so that was a 6-page slide for y'all. Share screen? No, I want to stop. Stop sharing. Stop sharing. So that was the spinal blueprint and a little bit of tips and tricks on hydration, what to eat, what to avoid, exercises, mindset of making sure that you are respecting your body, that you are giving yourself that self love. And of course, we have the back pain blueprint, understanding causes and breaking the cycle infographic that's already posted for everybody. And that is the lower back little workshop for everybody. So hit those planks, the dead bugs, the side planks to strengthen the pelvis, the obliques, the glute bridges, making sure that you are activating your core throughout the day, that you are stretching, that you are being hydrated, drinking your fluids, and eating healthy, and of course, having the mental fortitude of dealing with stress, going for that run, uh, hitting that heavy bag, or even shadow boxing. I'd have to do shadow boxing and doing whatever it takes to make sure that you show up for yourself and the people in your life as the best person you can be. Turning 44 this year, God's grace, Creator is, allowing me to experience this life and to have this platform at school and to be able to reach people on a larger scale, such as this platform or this modality of video coaching. It, it still goes in line with my purpose of helping and coaching and offering guidance as much as I can to the people that need assistance with fitness and health and mindset, and to be that community leader that I needed as a role model in my younger days. I recently did a testimonial for a community service recently, and I talked about my history and what has transpired since certain events in my past and our lives that we live. We have we have we have the power to write our days going forward. Even though my past can be filled with mistakes, lessons, mishaps, it is up to me to end that chapter and create something new. It is up to me and my responsibility and my accountability to throw that book away and start a new one, or simply turn the page, reset, realign, and keep going. So, with that, team, happy Friday. Day one Den, assistant coach, loving it. You guys know I am uploading everything. I also want to work on. I also want to work on programs that are. I want you. There's some things I'm working on for either as a one-time purchase for the basic entry that we have inside school, or it'll be included for our premium and above members. For example, perhaps a 4 week to strengthen your lower back, to improve your 10K run. I did a day one dead workout this morning. I went live on school and TikTok, and I did a 20-minute workout, and then I went for a 10K run. And it was I logged it with an app outside of Fighter FedEx, of course, because you don't have this capability yet. But it was my fastest 10K run, and I felt great. And that is the beauty of having goals written down, having a system that tracks or at least logs to show that I'm improving. So, for example, let's say, with the one den assistant coach, how it is far more beneficial than a standard PDF. When I first started trying the online approach with coaching, this is years ago. And of course, I had the PDF, I had the workouts, I had the videos going to go online, coincide with that specific program. It just didn't feel right. It didn't feel, it didn't have my touch. It didn't have, yeah, even though it was my creation for the workouts, but it wasn't quite there yet. And thankfully, with all my attempts of trying to crack the code of online coaching to make sure that the members and the clients have a far safer and quicker and in-depth experience with Fight for the X and the Day One Den. So now, with the one-time purchase or with the already included in certain memberships and above, we have the Day One Den assistant coach. For example, let's say, all right, okay, well, let's go for this 4-week, 6-week, improve your back, strengthen your back, etc. And of course, we would have certain exercises that would be filmed and then sent to me, sent to us for video analysis to make sure that, okay, well, this program you want to attend, or this workshop or course modules you want to invest in, we have to see where you are at and start with that baseline so we can make sure that at the end of the 4 weeks, 6 weeks, that there is a progression or that there is more awareness of limitations or strengths from day 1 to day 35. And having that interactive coaching ability and the technology behind it, coupled with my experience and expertise and knowledge of working with clients the past 16, 17 years as a personal trainer, 20 years as a martial arts instructor, and to further develop the pathway or the systems procedure, systems operating procedure, your SOPs for my business-minded folk out there, and to have that as a blueprint to build upon, to expand, and to give you guys the best things to ask for fitness. But that's what I'm thinking. Day One Den assistant coach is already there. The Fight for X calorie is already there. It has a picture upload that brings everything behind it. And happy Friday, team. I'll see you. Oh, so yeah, there'll be some adjustments as well on the calendar. Yeah, there's some adjustments on the calendar. All right. See you.